The brachial plexus is a network of nerves that originates from the spinal cord in the neck and extends into the arm, providing motor and sensory innervation to the upper limb. It is formed by the ventral rami, anterior divisions, of the lower four cervical nerves, C5 to C8, and the first thoracic nerve, T1. Occasionally, contributions from C4 or T2 may also be present. Structure of the brachial plexus. The brachial plexus is divided into 5 main components, from proximal to distal. 1. Roots, formed by the ventral rami of C5 to T1. These roots merge to form the trunks. 2. Trunks. Upper trunk, formed by the union of C5 and C6. Middle trunk, continuation of C7. Lower trunk, formed by the union of C8 and T1. 3. Divisions. Each trunk divides into an anterior and posterior division. Anterior divisions supply the flexor muscles, while posterior divisions supply the extensor muscles. 4th, cords, formed by the recombination of the divisions, named based on their relationship to the axillary artery. Lateral cord, formed by the anterior divisions of the upper and middle trunks, C5 to C7. Medial cord, formed by the anterior division of the lower trunk, C8 to T1. Posterior cord, formed by the posterior divisions of all 3 trunks, C5 to T1. 5. Terminal branches. These are the final nerves that emerge from the cords and innervate the upper limb. Musculocutaneous nerve, from lateral cord. Axillary nerve, from posterior cord. Radial nerve, from posterior cord. Median nerve, from lateral and medial cords. Ulnar nerve, from medial cord. Functions of the brachial plexus. The brachial plexus provides motor and sensory innervation to the shoulder, arm, forearm, and hand. Key functions include motor control. Innervates muscles for movement of the shoulder, elbow, wrist, and fingers. Sensory perception. Provides sensation to the skin of the upper limb. Clinical significance. 1. Brachial plexus injuries can occur due to trauma, e.g. motorcycle accidents, childbirth injuries. Common injuries include ERBS palsy, injury to the upper trunk, C5 to C6, causing weakness in shoulder and arm muscles, waiter's tip posture. KLUMPKE's palsy, injury to the lower trunk, C8 to T1, affecting hand muscles and causing a claw hand deformity. 2. Thoracic outlet syndrome. Compression of the brachial plexus as it passes through the thoracic outlet, leading to pain, numbness, and weakness in the arm. 3. Diagnosis and treatment. Diagnosed through clinical examination, imaging, MRI, CT, and nerve conduction studies. Treatment may include physical therapy, medications, or surgical intervention depending on the severity. Understanding the brachial plexus is essential for diagnosing and managing upper limb nerve injuries and conditions.